Olive oil is often referred to as liquid gold, and we think of it as a symbol of healthy eating and well-being. However, not everything is as harmless as it seems. Did you know that improper use of this oil can pose serious risks to your health? In this video, we will discuss 10 dangerous health problems associated with olive oil that can turn out to be a real disaster for you. From threats of atherosclerosis and cardiovascular disease to increased risk of cancer and liver dysfunction, you'll be amazed at how harmful a seemingly healthy oil can be. We'll reveal the dangers and tell you how to avoid these serious mistakes to protect your health. Watch the video to the end to learn what you need to do to avoid falling victim to these hidden risks. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Number 10. Circulatory problems. One of the serious risks of consuming olive oil is circulatory problems, especially in people with varicose veins or thrombophlebitis. Excessive consumption of fats, including those found in olive oil, can aggravate vascular health by causing blood stasis and increasing the risk of blood clots. Studies conducted by the American Heart Association have shown that excessive consumption of fats in the diet, even those such as olive oil, leads to blood clotting and poor circulation. In people with varicose veins and thrombophlebitis, this can be a catalyst for a worsening of the disease. The impaired blood circulation leads to stagnation in the veins, which creates the perfect conditions for blood clots to form. These clots can migrate through the body, posing the threat of life-threatening complications such as pulmonary embolism, which can be fatal, according to the Centers for Disease Control and Prevention. When fat enters the body in excessive amounts, blood becomes more viscous, making it more difficult for it to move normally through the blood vessels. This is especially dangerous for those who already suffer from circulatory disorders, as slowed blood flow leads to the formation of blood clots. These blood clots can block blood vessels, disrupting the flow of oxygen to vital organs. Robert Harper, 63, from Manchester, UK, has always believed that olive oil is a healthy alternative to other types of fats. He actively included it in his diet despite being diagnosed with thrombophlebitis. Over time, Robert's condition worsened. He began to experience severe leg pain and noticed swelling. It turned out that excessive consumption of fats aggravated his condition. Robert underwent surgery to remove blood clots, after which he completely gave up olive oil. For people with varicose veins, thrombophlebitis, and other circulatory diseases, it is important to strictly control the amount of fat intake, including olive oil. The American Heart Association recommends limiting fat intake to 20 to 30% of daily calories. Olive oil should be consumed in small amounts, emphasizing sources of omega-3 fatty acids, such as fish and flaxseed oil, which improve circulation and reduce the risk of blood clots. Number 9. Drug interactions. Consumption of olive oil can be a serious problem for people who are taking certain medications. This is because the components of olive oil can affect the absorption and metabolism of medications, which can reduce their effectiveness, or on the contrary, increase their side effects. This is especially dangerous for those who suffer from chronic diseases and have to take medications regularly to control their condition. Studies conducted by the National Institutes of Health have shown that olive oil can interact with certain types of medications, such as blood pressure medications, anticoagulants, and agents that affect blood sugar levels. These medications depend on a precise balance in the body, and interfering with their effects can be extremely dangerous. For example, olive oil has blood-thinning properties. This quality is useful in some cases, but for people taking anticoagulants, such as warfarin, it can lead to serious consequences. Combining olive oil with such drugs can excessively thin the blood, increasing the risk of bleeding, including internal bleeding. In addition, the Harvard T.H. Chan School of Public Health found that certain substances in olive oil can alter the metabolism of blood sugar-lowering drugs. This causes sudden fluctuations in sugar levels, which is dangerous for people with diabetes. Sudden sugar spikes can cause hypo or hyperglycemia, which increases the risk of complications such as diabetic coma. A prime example is Jonathan Williams, 54, from New York, USA, who suffered from hypertension and type 2 diabetes. He was taking medication to control his blood pressure and blood sugar, but, convinced of the benefits of olive oil, decided to add it to his food every day. After a few weeks, his condition deteriorated dramatically, with frequent nosebleeds, a sign of excessive blood thinning. Doctors found out that the combination of anticoagulants with large amounts of olive oil led to dangerous consequences, which could have ended in internal hemorrhage. Fortunately, the doctor's intervention prevented the tragedy, but Jonathan had to completely revise his diet and eliminate olive oil. To avoid similar situations, it is extremely important to consult your doctor before adding olive oil to your diet if you are taking any medications. Experts at the American Heart Association recommend closely monitoring food-drug interactions. If you are taking anticoagulants, blood pressure medications, or controlling blood sugar levels with medications, you should strictly monitor your olive oil intake and possibly reduce it to a minimum. It is also advisable to monitor your blood and sugar levels if you decide to include olive oil in your diet. Regular checks will help prevent dangerous consequences. Number 8. Kidney disease. Consuming a lot of fats, including olive oil, can seriously impair kidney function, especially in people who already suffer from chronic diseases of this organ. This is because the kidneys are responsible for filtering the blood and excreting metabolic waste products, including fats. When excessive amounts of fats enter the body, the kidneys are forced to work with an increased load, which in the long term can lead to kidney failure or the development of nephropathy. Research conducted by the Centers for Disease Control and Prevention has shown that a high-fat diet, including regular olive oil consumption, can contribute to elevated blood lipid levels. This puts extra strain on the kidneys, especially in people with a predisposition to chronic kidney disease. Over time, this can impair their filtering ability, leading to a buildup of toxins in the body. According to the findings of the American Diabetes Association, type 2 diabetes patients with kidney complications have a 30% higher risk of developing kidney failure from excessive fat consumption. Special attention should be paid to the results of a study conducted by the National Institute on Aging, which proved that even a moderate increase in the amount of fat in the diet of people over 50 years of age increases the likelihood of kidney dysfunction by 15%. This is due to the age-related decline in the kidney's ability to cope with a high load. Consuming more than 30 grams of fat per day can be critical for people with pre-existing kidney disease, such as chronic glomerulonephritis or diabetic nephropathy. Emily Jenkins, 63, from the UK, had long considered olive oil as the foundation of a healthy diet. However, she suffered from type 2 diabetes and experienced occasional kidney problems. After she started consuming 2 tablespoons of olive oil daily, her condition began to worsen. Doctors diagnosed worsening kidney function, and Emily was on the verge of developing chronic kidney failure. Her mistake was not taking into account the effects of fats on her weakened kidneys, which almost had fatal consequences. It is crucial for people with chronic kidney disease or a predisposition to it to control the intake of fats in their diet, including olive oil. American Heart Association experts recommend limiting the amount of fat consumed to 25 to 30 grams per day to avoid putting additional strain on the kidneys. It is also important to consider your overall health and consult with your doctor before incorporating foods such as olive oil into your diet. Regular medical checkups and monitoring of kidney function will help in detecting possible complications in time. Number 7. Gastritis and peptic ulcer. Olive oil, despite its reputation as a healthy product, can be a real threat to those who suffer from gastritis and stomach ulcers. This is because the oil stimulates increased secretion of gastric juice, which increases inflammation of the gastric mucosa and promotes the formation of new ulcers. For people with pre-existing stomach diseases, this habit can lead to serious complications such as gastric bleeding, which, in case of neglected conditions, can be life-threatening. A study conducted by the National Institutes of Health found that regular consumption of more than 2 tablespoons of olive oil per day in people with chronic stomach disease increases the risk of gastritis exacerbation by 25%. This effect is due to the fact that the oil stimulates the active secretion of hydrochloric acid, which creates increased acidity in the stomach. Over time, this leads to erosion of the mucous membrane and contributes to the formation of ulcers. This effect of olive oil on the stomach is especially dangerous for the elderly. According to a study by the National Institute on Aging, people over the age of 60 have a 15% increased risk of developing ulcers or complications related to gastritis if they consume olive oil daily. Increased acidity in the elderly increases the risk of not only exacerbation of chronic diseases, but also the occurrence of gastric bleeding, which can lead to emergency surgery. The American Institute for Cancer Research has also found a link between chronic inflammation of the gastric mucosa and an increased risk of gastric cancer. Prolonged irritation of the stomach walls caused by excessive secretion of gastric juice increases the likelihood of malignant cell changes, making the problem even more dangerous. George Brown, 58, from Canada, has always considered olive oil an essential part of his diet. Being a stickler for healthy eating, he didn't realize that his daily habit of adding oil to salads and dishes was worsening his chronic gastritis. Over time, George began to notice an increase in stomach pain and acidity. One day, after a large dinner with lots of olive oil, he ended up in the hospital with a stomach bleed that required surgery. His mistake was ignoring his body's signals and not connecting the worsening condition to his oil consumption. For people with chronic stomach disease, it is important to limit olive oil consumption, especially in its pure form, on an empty stomach. American Heart Association doctors recommend that people with gastritis or ulcers minimize their fat intake and avoid foods that stimulate the secretion of gastric juice. This will help reduce the risk of exacerbations and improve overall health. Number 6. Diabetes and insulin resistance. Olive oil, often advertised as a health benefit, can have negative effects on people suffering from diabetes and insulin resistance. Despite its many health benefits, excessive consumption of fats, including olive oil, can impair insulin sensitivity, making it more difficult to control blood sugar levels and increasing the risk of developing serious complications. Research conducted by the Harvard T.H. Chan School of Public Health found that high-fat diets may contribute to worsening insulin sensitivity. The study, published in the journal Diabetes Care, found that consuming large amounts of olive oil and other fats can lead to increased blood sugar levels and the development of insulin resistance. This is because excess fats affect the metabolism of cells, reducing their ability to respond to insulin. According to the American Diabetes Association, high-fat intake can also contribute to fat accumulation in the liver, which in turn impairs blood sugar control. Studies show that consuming more than 30 milliliters of olive oil per day in people with type 2 diabetes shows a significant increase in glucose readings and a decrease in the effectiveness of therapy. This makes diabetes management more challenging and requires additional medical interventions. The Centers for Disease Control and Prevention also confirm that excess fat intake is associated with an increased risk of developing type 2 diabetes and its complications. Excess fat can interfere with normal insulin function and promote systemic inflammation, further impairing blood sugar control. Anna Miller, 52, from Australia, suffered from type 2 diabetes and led an active lifestyle with a diet rich in olive oil. She believed it would help improve her health, but did not realize that excess oil consumption could negatively affect her blood sugar control. Over time, her glucose levels increased significantly, and she had to change her therapy as well as modify her diet. Anna realized that her mistake was ignoring the recommendations to limit fats in her diet. For people with diabetes and insulin resistance, it is important to watch the amount of fats consumed, including olive oil. It is recommended to limit oil intake to 1 to 2 tablespoons per day and monitor the balance of fats and carbohydrates in the diet. Consultation with a dietitian and regular monitoring of blood sugar levels can help prevent negative effects and maintain good health. Number 5. Gallbladder disease. Olive oil, despite its reputation as a healthy product, can pose a serious threat to people with gallbladder disease. Its accompanying consumption can exacerbate the condition in gallstone disease, leading to acute pain, inflammation, and increasing the risk of more serious conditions such as cholecystitis and gallbladder cancer. The gallbladder is an organ that plays a key role in processing fats. It produces bile, which helps digest fats. Olive oil, as well as other fatty foods, can stimulate increased bile production. In people with pre-existing problems, such as gallstone disease, this can cause new stones to form or increase the size of existing stones. This, in turn, can cause acute pain, inflammation, and even infections. According to the American Institute for Cancer Research, high-fat intake can contribute to the development of gallstone disease and worsen the symptoms of pre-existing gallbladder disease. Studies have shown that excessive amounts of fat in the diet can contribute to an increase in cholesterol in the bile, which is a major risk factor for gallstone formation. The Harvard T.H. Chan School of Public Health also confirms that people with gallstone disease who consume large amounts of olive oil may experience an exacerbation of symptoms. The study, published in the journal Gastroenterology, found that excessive fat consumption increases the risk of gallbladder inflammation and complications such as cholecystitis. This is because bile becomes more concentrated, leading to an increased likelihood of stone formation and gallbladder wall irritation. Martha Schmidt, 48, from Germany, suffered from gallstone disease and had been consuming olive oil regularly for a long time, believing it to be good for her health. She did not take into account that excessive amounts of fat could aggravate her condition. As a result, her symptoms worsened, and she began experiencing frequent bouts of pain and inflammation, leading to the need for surgery to remove her gallbladder. She realized that the mistake was her misconception about the effects of olive oil on her condition. If you suffer from gallstone disease or other gallbladder conditions, it is important to control your intake of fats, including olive oil. It is advisable to limit its use and replace it with less fatty alternatives, such as vinegar or lemon juice for salad dressing. It is also important to consult with a doctor or dietitian to determine the best dietary regimen to help minimize the risk of exacerbations and maintain gallbladder health. Number 4. Pancreatitis. Olive oil, although recognized as beneficial in moderation, can cause serious problems for those who suffer from or are predisposed to pancreatic disease. The main threat is the high fat content, which can provoke inflammation of the pancreas, leading to dangerous and potentially fatal conditions. The pancreas plays a key role in digestion and blood sugar regulation. High fat content in the diet, including olive oil, can cause the pancreas to release enzymes more intensely, which in turn can lead to its inflammation, known as pancreatitis. This inflammation can worsen the course of the disease and lead to more severe conditions such as pancreonecrosis, necrosis of pancreatic tissue. A study conducted by Howard Hughes Medical Institute found that high-fat intake can trigger the development of pancreatic inflammation and increase the risk of chronic damage to the pancreas. In their study, published in the journal Nature, scientists found that excess fat can contribute to pancreatic malfunction, leading to pancreatic inflammation and increasing the likelihood of developing pancreatic cancer. According to the National Institutes of Health, prolonged exposure to high-fat foods can provoke chronic pancreatitis, which in turn is linked to an increased risk of pancreatic cancer. Research confirms that fats, especially when consumed in excess, play a significant role in the development of inflammatory processes and increase the likelihood of malignant tumors. Alexander Petrov, 55, from Russia, was a longtime fan of olive oil, believing it to be healthy. He often added it to his meals without considering the possible consequences. As a result of constant excessive consumption of olive oil, he developed pancreatitis. His symptoms worsened, leading to the need for hospitalization and further treatment. Doctors found he had signs of pancreatitis, and he was forced to change his diet and seek medical attention. For people with a predisposition to pancreatic disease or those who already suffer from pancreatitis, it is important to control fat intake, including olive oil. Fatty foods should be reduced and used in moderation. In return, you can include more fruits and vegetables in your diet, as well as fiber-rich foods that help keep your pancreas healthy. Also, consult your doctor or dietitian to adjust your diet to minimize the risk of inflammation and other complications. Number 3, liver problems. Olive oil, considered by many to be a healthy and wholesome choice, can hide underlying dangers to liver tissue, especially when consumed in excess. Although olive oil contains monounsaturated fatty acids that are actually good for the heart, excessive consumption can lead to serious liver problems. Excessive consumption of fats, including olive oil, can significantly increase the risk of developing fatty liver disease. This process begins with the accumulation of fat cells in the liver, which can lead to a condition known as non-alcoholic fatty liver disease, NAFLD. When this condition progresses, it can develop into more serious conditions such as cirrhosis or even liver cancer. Research conducted by Howard Hughes Medical Institute has demonstrated that excess fat in the diet can cause inflammation and oxidative stress in the liver, which accelerates the progression of fatty liver disease and increases the risk of developing cirrhosis. In a publication in the journal Cell Metabolism, scientists reported that fat accumulation in the liver leads to liver inflammation, which can contribute to the development of fibrosis and cirrhosis over time. According to the National Institutes of Health, fatty liver disease is associated with numerous health risks, including the development of cirrhosis and liver cancer. NAFLD can be especially dangerous for people with pre-existing liver problems or those who have a predisposition to these diseases. Antonio Rivas, 52, from Spain, fell victim to liver problems due to his immoderate consumption of olive oil. Although he considered this oil to be healthy, he did not take into account that excessive amounts of it could cause liver problems. As a result of constant overeating and excess fat in his diet, he developed fatty liver disease, which eventually led to cirrhosis. His physical exams revealed a significant increase in fatty deposits in his liver and signs of inflammation. To reduce the risk of liver disease associated with excess fat, it is important to eat olive oil and other fats in moderation. Limit the amount of oil used in your diet and strive for a varied and balanced diet. Include more fruits, vegetables, whole grain products, and protein sources in your diet to support liver health. Regular health checkups and consultations with your doctor or nutritionist can help monitor your liver health and prevent potential problems. Number 2, obesity, especially of U.S. residents. Olive oil, which is considered by many to be exceptionally healthy, may be hiding underneath the dangers for those facing overweight and obesity issues. While moderate consumption of olive oil as part of a balanced diet can have its benefits, its overuse can have undesirable consequences, especially in the context of combating obesity. Obesity is one of the most serious health problems in the world today, especially in the United States. According to the Centers for Disease Control and Prevention, CDC, more than 42% of American adults are obese. Consuming excessive amounts of fats, including olive oil, can contribute to further weight gain and make weight loss more difficult. The American Heart Association emphasizes that excessive fat consumption can contribute to body fat storage and increase total calories, making the fight against excess weight even more difficult. Too much olive oil in the diet can lead to a calorie surplus, which in turn contributes to fat storage and obesity. The Harvard T.H. Chan School of Public Health also warns of the risks associated with excess fat consumption. One of their studies indicates that a high-fat diet can affect metabolism, making it harder to burn calories and contributing to fat storage. Marcus Hansen, 45, from the United States, fell victim to the problem of obesity due to excessive consumption of olive oil. Although he believed olive oil to be healthy, he did not take into account that excessive amounts of it could lead to an increase in the calorie content of his diet. As a result, his consumption of olive oil in large amounts, along with other high-calorie foods, led to significant weight gain and obesity. To prevent obesity and control body weight, it is important to use olive oil in moderation. Instead of using it in large quantities, it is wise to include it in small portions in a balanced diet. Focus on calorie control and maintaining a varied diet that includes fruits, vegetables, protein foods, and whole grains. Regular physical activity and consultation with a nutritionist can help you maintain optimal body weight and avoid obesity-related problems. Now let's look at the most dangerous item of all. Number 1. Atherosclerosis and cardiovascular disease. When it comes to healthy eating, olive oil is often seen as a one-stop solution to help reduce the risk of cardiovascular disease. However, despite its benefits, excessive consumption of olive oil can have the opposite effect and contribute to the development of atherosclerosis, as well as other serious cardiovascular diseases. Atherosclerosis, or the accumulation of fatty deposits in the arteries, is one of the main causes of cardiovascular disease. Consuming olive oil in excess can increase the total amount of fat in the body, which in turn can contribute to the accumulation of lipids in the artery walls. According to the American Heart Association, excessive consumption of fats, even if they are healthy fats such as monounsaturated fats from olive oil, can increase blood lipid levels, which increases the risk of atherosclerosis. A study conducted by the Harvard T.H. Chan School of Public Health found that excessive consumption of fats, including olive oil, is associated with an increased risk of cardiovascular disease. The study emphasizes that even healthy fats, when consumed inappropriately, can contribute to cholesterol buildup in the arteries and increase the risk of heart attacks and strokes. Centers for Disease Control and Prevention also emphasize that atherosclerosis can lead to serious consequences such as heart attacks and strokes. The buildup of fatty deposits in the arteries restricts blood flow and poses a cardiovascular risk. Carlos Gomez, 52, from Spain, is an example of how excessive olive oil consumption can lead to cardiovascular problems. Although Carlos used olive oil, believing it to be healthy, he did not control the amount. His excessive fat intake, combined with other factors such as lack of physical activity, led to the development of atherosclerosis and an increased risk of heart attack. To avoid the risk of atherosclerosis and cardiovascular disease, it is important to follow a moderate intake of olive oil. It is recommended to use olive oil in moderation, adding it to salads and meals as a dressing rather than as a primary source of fat. Portion control and combining oil with low-calorie, nutrient-rich foods will help maintain cardiovascular health. Regular physical activity and a balanced diet are also key factors in maintaining healthy arteries and reducing the risk of cardiovascular disease. In this video, we use data from several major U.S. organizations that play a key role in studying the biological processes of aging, finding ways to slow aging, and developing innovative technologies to extend life. Read more about them in the description below the video. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.